WTNH Health News, overcrowded hospital emergency rooms. Nationally, the wait can be as long as more than 6 hours.
At issue, access to health care. News 8 medical reporter Jocelyn Memento looks at how one Connecticut hospital is tackling this critical problem.
It's midday in the emergency department at Backus Hospital in Norwich. Already, every room available for a patient is filled, except for one. Waiting patiently, Hilda Ford.
My doctor referred me to the ER because I went to see him after I had an episode about not, being able to breathe. So he sent me here.
Depending on volume and time of day, patients here could wait 2 to 3 hours.
We're saturated, and it's where we expected to be in about 4 years from now. We were thinking we'd be at the volume we're at now.
Dr. Bob Sidman is Chief of Emergency Services.
If we are able to reduce some of our volume, especially for things that are non-emergent, we can have more time to take care of patients who are having an emergent problem.
They are getting some relief by way of redirecting the uninsured with no access to primary care.
A web-based tool that allows our emergency department physicians and providers to create follow-up appointments for patients who are being discharged from the ED with no means to follow up with a primary care physician in the community.
There's oftentimes I'll have a patient who comes in with a condition that is pretty serious but not something I need to admit them to the hospital for. Now I have to look at the patient and say, geez, I don't see that you have anyone to follow up with, and if I don't have that opportunity to have them follow up, I may have to admit them.
We've done about 1,000 appointments to date.
Appointments with primary care physicians at local federally funded health care centers.
By and large, we found that those who do keep their appointments with their primary care physicians have reduced their emergency department return by 43%.
I love seeing everybody coming in. It's a backhanded compliment, but we're not the best people for all problems.
Meanwhile, the wait for Hilda Ford
I do expect to wait.
is at 45 minutes and counting.
And for people coming into the ED for chronic problems, Dr. Sidman says if they are connected with a primary care physician, they are more apt to stay healthy. Back to you.